Good morning, and thank you all for attending today's webinar, WISHIN 2.0 Transition Executive Overview. We are proud to introduce to you a new chapter of WISHIN's existence and our partners that are making it a reality. My name is Steve Rotman, Chief Operating Officer at WISHIN, and I will be the moderator for this morning's webinar. Please know that this webinar will be recorded and available on WISHIN's YouTube channel. All attendees have been placed in a mute. If there are any questions, please submit those through the GoToMeeting chat feature, which you'll find on the top right of the GoToMeeting window. Know also that questions will be posted to our WISHIN 2.0 webpage for reference. I'd like to introduce to you this morning our speakers. First, Joe Kahelski, WISHIN CEO. He will be providing an overview of WISHIN 2.0 and our hybrid vendor transition. Next will be an introduction to Velatura from Melissa Erickson, Solutions Lead at Velatura. Then an introduction to KPI Ninja from Amanda McCollum, Senior HIE Project Manager, and Renee Town, Director of Quality Programs at KPI Ninja. Finally, we'll come back to Joe, who will provide a brief on the measure year. Again, if you are not muted, please mute yourself. Ashley, if you could help with that.
Of course, I'm cooking more than that. So I'll probably do some cooking.
And apologies for that. Finally, we'll come back to Joe, who will provide a brief on the measure year 2021 Medicaid P4P hospital incentive and close out the webinar. Thank you all again for attending, and Joe.
Well, good morning, everyone. Thank you for joining us. We're really pleased with the interest that we've seen in this webinar and the two that will follow this week, tomorrow and Thursday. We've got a lot to talk about. We raised the curtain on WISHIN 2.0 at our annual summit meeting in March, and we're coming back now to give you a little bit more detail and understanding of what's really right around the corner now. As Steve said, we are moving to a new technical environment with new partners, and those are Velatura and KPI Ninja, and we'll hear from both organizations a little bit later today. So WISHIN 2.0 is everything you've been able to experience through WISHIN, but more. We're going to be bigger and better, enabling new kinds of use cases, new kinds of functionality. We're moving to a reliable, high trust common security framework infrastructure, and using Amazon Web Services as kind of the foundation for that. We're confident that the new patient matching algorithms we'll be using are going to be an improvement over WISHIN 1.0. When we went looking for a new partner, we really wanted a very modular system, something that was innovation friendly, and I think as you learn more about 2.0, what we can do and what we're planning to do, you'll see that we are going to be a much more innovation-oriented organization. So we're going to be able to handle new data sources, including social determinants of health, claims. We're going to be able to handle various inbound and outbound types of data, HL7 version 2, which we're all familiar with. CCDAs we're familiar with. Fire APIs, a lot of talk, certainly in the last year or two, about Fire APIs, other kinds of APIs, third-party applications, flat files, et cetera. I mean, we wanted an environment that was really able to handle bolt-ons of anything, really. We wanted a very modular system, and we're confident that when the transition is complete, that's where we'll be. In terms of the sort of end user experience, the WISHIN Pulse community health record is going to be redesigned, and some of you have seen a little sneak preview of WISHIN Pulse, and we'll get into that a little bit further with our business webinar tomorrow. One of the features of the new version of WISHIN Pulse will be some very slick built-in analytic functionalities. So, and we're confident it's going to be more intuitive and more of what you want to know when you're using the community health record, sort of right at your fingertips. We'll be able to parse inbound CCDAs and create a normalized, deduplicated super CCDA, a patient-specific super CCDA. Obviously, CCDAs, electronic care summaries, are meant to be ingestible into a sort of foreign EHR from where the information originated, and there's a lot of power, obviously, in a super CCDA for folks needing to access that information. We'll have new single sign-on capabilities. We do a lot of single sign-on work now with clients. We know how important staying in the workflow is when accessing clinical data through WISHIN. A big emphasis for us in WISHIN 2.0 is expanding our ability to support quality initiatives, quality uses of clinical data. So collection of quality data, using it in the context of NCQA/HEDIS kinds of use cases, other similar purposes. We're going to be positioned very soon to add a lot of value to that process, both on the payer side and the provider side. And analytics, talked a little bit about that already. We're going to, right out of the gate, have some built-in analytic types of functionalities in the WISHIN Pulse community health record, but our vision is to really up our game in the analytics area as we move through the future, and you'll see that as we get further into this transition. The next slide. So as Steve mentioned, we are working with a pair of technical partners in the context of WISHIN 2.0. We went shopping for a new vendor and we came home with two. We liked what Velatura and KPI Ninja could offer as a partnership, as a hybrid technical foundation for WISHIN. So as I mentioned, all in the Amazon Web Services kind of foundation and infrastructure. Very simply and at a very high level, Velatura is serving as the back end of the WISHIN network, and KPI Ninja serving as the front end. Again, that's a very high level generalization, but we're looking to Velatura to handle the data ingest. So data from our data submitters coming through the pipe and being taken in by Velatura. So any kind of routing that needs to be done, any kind of patient matching to support the community health record and other use cases, supporting automated query and retrieve, handling outbound interfaces, storing our data, the foundational data, handling the direct secure messaging, all of those, and the participant onboarding and transformations, all of that side of the equation being handled by Velatura, based in Michigan, and really grew out of the MyHIN HIE experience in Michigan. Velatura will also be handling our outbound public health sort of use cases. So we're supporting syndromic surveillance submissions for many of our clients. We're also enabling automated immunization reporting to the Wisconsin Immunization Registry for some of our clients. All of that taking place on the Velatura side of the house. They'll also be sharing the ADT messages that come in through our partner Patient Ping, our event notification service partner Patient Ping. So they'll be handling that piece of the equation, and then KPI Ninja from Lincoln, Nebraska, handling most of what we call the experience of the data for our end users. So KPI Ninja will be hosting essentially the new WISHIN Pulse, the new version of WISHIN Pulse, the community health record. They'll be handling the super CCDA, administering the single sign-on method of accessing the data. They'll be taking care of the patient activity report, which is a version of event notification that some of our payers are using. I mentioned the quality use cases. A lot of that's going to sit with KPI Ninja, so the NCQA data collection and measure process, the operational reports, the administrative reports that we routinely handle or monitor, I should say, consent management, and a lot of the analytics are going to be on the KPI Ninja side of the house. They'll also be connecting the community health record with the Wisconsin EPDMP and the Wisconsin Immunization Registry, both of which are currently integrated into, visually integrated into the WISHIN Pulse community health record. So the substance, the controlled substance utilization and the immunization history and schedule, both are visible through the WISHIN Pulse community health record. So that's displaying within any given patient's community health record. So next slide. So really, this transition to WISHIN 2.0 is about the future, and is about better positioning WISHIN and our customers for the future. We know that the world of interoperability is changing, evolving all the time. We know that the healthcare environment is moving more and more toward value-based care of one kind or another, and interoperability, health information exchange can help move the ball forward in many ways in the healthcare environment of the future. Obviously, with health information exchange, one of the basic value propositions is reducing manual processes, right? Banning the fax machine, automating what can be automated, and ensuring that once healthcare data is digitized, it stays in digital form when it gets shared. There's no need to de-digitize it in order to share it. So just sort of the transactional piece of health information exchange, automating those processes is a key value proposition. But there are more and more ways in which health information exchange can advance the ball for value-based care, tracking utilization, dealing with chronic conditions, the alerts and notifications, advancing population health, bringing in social determinants of health. This is a trend we see all over the country as health information exchanges are getting involved in making available social determinants of health data and advancing the cause of better quality, lower cost care. All kinds of research indicates that social determinants play a huge role in quality and outcomes, and it only makes sense to us that given the infrastructure that we've put together, all the pipes that we've laid all over the state, it makes sense for us to use that infrastructure and branch out beyond the purely clinical types of data to bring in this additional type of data that really makes a difference, can make a difference in outcomes and in quality. And then we can stretch that out all the way to machine learning, artificial intelligence, potentially risk stratification, predictive analytics, all with the goal of making sure that the right care is delivered to the right person at the right time. Next slide. So we're aware that transitions involve some work. We're aware that transitions involve some disruption. And before we went down this road, we set some goals for the transition and things that will be our touchstones as we move forward. So next slide. Number one on our list is really minimizing the burden and impact on WISHIN customers. The transition is not zero work for anybody, but it is worth keeping in mind that we want to make this as unobtrusive as possible. We do need our data submitters to send their data to a new endpoint, but we're trying to make that process as painless as possible, and we always have that in mind as we move through this process. I mentioned that we really wanted a modular, scalable architecture that positions us to innovate. That's the bottom line, and innovate on behalf of our customers. We know there are needs, and we've heard our customers communicate with us with variants of, it would be great if you could do X. We've heard that over and over in many different ways, but that's a common theme. Can you help us do X? And that's why we're here. We're here to help you do X. And we feel like we are going to be in a much better position to help you do X when the dust settles on this transition. We feel very good and very confident about the complementary organizational strengths that we are bringing to bear and making available to our customers and working with KPI and Velatura. You'll hear more from them in a moment about what they do and how they do it. We couldn't be more pleased that we're working with these two organizations, and I think it's going to be a breath of fresh air for everyone as we move through this process. And of course, when we're dealing with this sort of hybrid environment, one of the things you have to be aware of is that you're not duplicating anything on one side of the line or the other, and we need to minimize that. Just keep that in mind. We've got two organizations essentially working for one customer, and our idea is that we've got to be smart about how we set this up and make sure that we're not duplicating effort, and make sure it's functioning as one system, even though there are two technical environments involved. So next slide. So the timeline that we're dealing with is September 2021. At the end of September is our scheduled transition date. So our hope is that we've got all of our clients' data submissions transitioned by then, tested, et cetera, ready to go. Our intent is to do the cutover right about at the end of September. We are obviously still in business in our current technical environment. Data is now populating both environments, and so we've got that redundancy. So we're not starting from zero when we do the cutover. We'll have all the historical data accessible, et cetera. So once we get past the cutover and finish all of the punch list when it comes to the transition, we really want to engage more aggressively and more frequently with our clients. We're constructing a roadmap here, and we have so many new possibilities about what WISHIN 2.0 can look like. And so we really want to hear from you. You will hear from us in the coming months about opportunities to engage, to be at the table, and help us develop that roadmap and help us address the pain points that you're encountering when it comes to interoperability and access to records that originate somewhere else. Next slide. So from the timeline standpoint, we are in this chunk of time between July and August where we're counting down really toward user acceptance testing. There are a lot of organizations, a fair number, that we still need to get transitioned in terms of pointing their data at the new environment, at Velatura. I think we can still do that. And as I said, September 30th is the intended go live date and the cutover from the Medicity HCI environment. Next slide. So we've migrated a number of organizations, migrations in process for some others. We're scheduling with the balance. And we've had experience, obviously, helping organizations through this process. Shouldn't be that painful, but we're certainly encouraging folks to do this work sooner rather than later. And to the extent there are any issues, we'll have time to deal with them. But we're pleased with the cooperation we've experienced so far from our clients, and looking forward to wrapping up the migration part of this and jumping into the testing process right away after that. So next slide. That is that's the overview. that's the summary of what we're trying to accomplish, what the future is going to look like, and the invite to all of you to be part of that process, to be part of the way in which we chart our future. Frankly, we have so many new possibilities that we're going to have to make some decisions on prioritizing, what we do sooner rather than later. And we want all of our customers to be part of that process. And so, as I said, we are going to be reaching out within the near future and talking about a new kind of engagement process with our clients, because we think that's really the way to go. We are here to serve you, and we're going to put an emphasis on feedback mechanisms and a structured kind of customer engagement process. So you'll hear more about that in the near future. At this point, I'm going to turn it over to Melissa, and she's going to talk about Velatura. Go ahead, Melissa.
Thanks, Joe, and thanks for that lead-in and the nice overview of the project. Good morning, everybody. My name is Melissa Erickson, and I am serving as the account manager and primary liaison for WISHIN for the Velatura team. And along with my team, I am thrilled to be working with WISHIN and our counterparts KPI Ninja on this exciting project and support their transition to this new hybrid platform model. Next slide, please. So a little about Velatura. As Joe alluded to, our company is rooted in health information exchange. As we really started our journey in Michigan, or the other mitten states, I'll say, at the Michigan Health Information Network, or MyHIN. And like WISHIN, MyHIN is a health information network serving similar stakeholders with a similar mission to expand interoperability and improve healthcare quality and efficiencies by making valuable data available at the point of care. And as we were working through establishing our model in Michigan, we were feeling the pressures of some of the challenges this HIE landscape is facing, and wanted to address things like increasing costs and some of the lack of flexibility we felt with some of the traditional models and platforms. So Michigan developed its own modular HIE platform and products on AWS to really allow for our organization to more easily scale and address some of these changing landscape and stakeholder needs in Michigan. So after establishing a successful model in our state, different states and organizations started to approach MyHIN for services, which really led to the establishment of Velatura. And as a public benefit corporation, Velatura is really able to help start solving interoperability challenges and build solutions to really scale across a diverse set of stakeholders outside of the Michigan market. So to think of it, MyHIN really serves the Michigan market, while Velatura is kind of the external Michigan market facing service. And now, as of now, we've expanded our footprint beyond the Great Lakes to include clients in New Jersey, Georgia, Missouri, and now Wisconsin. And as on the screen here, you can see we've also recently launched Interoperability Institute, which really houses our R&D arm and workforce development, which now includes over 80 interns working on various healthcare IT projects and some of the emerging trends we're seeing, like things like FHIR and social determinants of health. And in this model here, Velatura really is the front door to what we call to the constellation of shared services behind the scenes. So some of these services, including things like interoperability advisory and consulting, policy work, technical and networking services, onboarding, which some of you on the phone may have already worked with some of our team there, as well as cybersecurity and help desk. And so with this model, Velatura is able to essentially reach back into the 200+ people behind the scenes and put together a tailored solution based on our products and teams and services to meet our clients' needs. Next slide, please. So Velatura also has exclusive rights to resell MyHIN's modular cloud-native products. And as Joe mentioned, the core of our offering is really our patient-centered data exchange platform, which is the backbone we are implementing here in Wisconsin. And we've built our platform in this modular fashion, so we're really able to decouple products and services, which has really allowed us the opportunity to collaborate with KPI Ninja in this innovative hybrid model. And additionally, our offerings expand to help support some of healthcare's top trends and needs, including telehealth, public health reporting and monitoring, population health, and 21st century cures requirements we've seen, especially related to some of the payer requirements around APIs. And as Joe alluded to, one of our most recent endeavors is working towards bringing in the social determinants of health and building out some of these closed loop referral platforms that we know is so crucial to health outcomes in our industry. Next slide, please. So as industry needs and regulations continue to evolve, our focus really still remains on our passion, which is to advance interoperability. And unique to us, unlike some of the other vendors, as I mentioned, we do share that same business need and challenges other HIEs like WISHIN are experiencing and have a demonstrated experience in establishing a successful network and exporting the expansion of health information across the Midwest, as we can see here in this slide. So with that, we're so excited to partner with WISHIN and KPI Ninja to support WISHIN's mission and serve their stakeholders and advance the interoperability here in Wisconsin. And with that, I believe I'll hand it over to Amanda from KPI.
Thank you, Melissa. My name's Amanda, and I'm here to introduce you to KPI Ninja. Next slide, please. So a little bit about us as a company. Again, as Joe had mentioned, we're based out of Lincoln, Nebraska. And our company really focuses, again, on interoperability, providing enterprise analytics and front-end HIE solutions. We're supporting about 22 million lives, all across the country, both with HIE support as well as value-based care program support. One of the items that we pride ourselves on is that we're dual certified in ECQMs and HEDIS measures from NCQA. And we're an AWS partner as well as ONC certified. So we're happy to bring our expertise in these areas to WISHIN and to you all as the participating organizations. Next slide, please. So a little bit about how we see ourselves assisting as the market kind of evolves. The first thing is we really are looking forward to working with WISHIN to assist in being sustainable. So how will we do that? Well, we'll seek to provide advanced analytics, as Joe had mentioned, and providing those types of quality reporting and quality solutions, both to payers and to clinical organizations that will assist them, as well as assist WISHIN in providing a value add to the organizations. And from a clinical standpoint, also looking at, covering that gap of the last mile, if you will, of interoperability. So we mentioned the community health record, and supporting that via single sign-on. We also, as Joe mentioned, will have the patient activity reports, which serve as daily notifications, to let either payers or clinical organizations know what their membership or what their attributed patients are doing as far as interacting with emergency rooms, inpatient stays, and so on. So really getting both the ability to search for the patient and retrieve all of the clinical data from across the state in one place, as well as provide those alerts right to the workflow of the user so they know to go begin engagement with that patient to provide follow-up and also to provide some preventive services perhaps to minimize utilization in the future. So really kind of bridging that gap or that last mile to get that information out to the clinicians. Also, again, we are seeing growing data needs as the reimbursement models change. So being able to receive into our clinical data repository all of the data as Velatura, gathers and provides from all of your organizations, and making that data available out to other organizations that may need it, again, like payers and accountable care groups that are tracking the quality of the patients. And then looking at increase in the demand and alternate use cases, again, social determinants of health and other growing areas where this data could be used are things that we're trying to make sure that we're staying ahead of as we implement with WISHIN to make sure that we're providing the utmost service. Next slide. And I'll have Renee jump in and cover this slide for you.
Great, thanks so much, Amanda. So yeah, as we've been discussing, there's this tremendous opportunities for HIEs to address the growing needs of population health and value-based care. And as Amanda detailed, here at KPI, our passion is making an impact on the outcomes rather than just solving interoperability problems or building dashboards, but really focused on using and providing data to be a catalyst to healthcare improvement. So we wanted to provide you a closer look and some examples of what this actually looks like when they're rolled out as a deliverable or an output to HIE participants. So as you see on this slide here, here's a high-level overview of a few of the case studies or use cases that we help solve through our analytics and population health capabilities. So as you can see, it's the end-to-end population health, no matter where that data burden exists. Looking at population health use cases and understanding your population, its risk, its morbidity patterns, identifying risk factors that may lead to health problems. That second bucket there is use cases related to care management. So this is how you can manage patients, proactively identify those that are at risk for higher healthcare costs and utilizations, evaluating the effectiveness of your program and your interventions. That third piece there is the performance analysis. So this is where we can start comparing different groups, providers, settings, and start saying, once case mix is accounted for, is the variation that we're seeing because of the illness or the complexity of the population, or potentially how medicine is being practiced. So again, really targeting on improving those health outcomes. And then finally, lots of analytics around cost reduction initiatives and assuring that monies are allocated in a fair and equitable manner, especially as Amanda said, with many of these value-based programs that have capitation built into their programs. Next slide, please. So the biggest thing here at KPI is we like to meet the participants where they're at. So whether that's alerts, reports, dashboards, metrics, quality calculations, supporting reporting directly to different payers, as well as more sophisticated population health tools. On this slide, we provided you a high-level overview, but we have over 15 different risk models that yield both concurrent and predictive insights on predicted costs, utilization, resource use, as well as predicted sentinel events, so those adverse health outcomes. As well as we have hundreds of different risk markers or risk factors. So you can see over there on the right-handed side, things like disease. So we can look at a population, say this is your morbidity. You can look at specific cohorts within that or subpopulations, like these are the individuals that are frailty or more likely to seek out care in a hospital setting. We can look at pharmacy, opioid users. We can marry those different data sets together. That's the best part about the HIE. And so if you look at diagnosis and pharmacy, creating a report or a list of patients who aren't receiving pharmaceutical treatment, although they have a specific chronic condition identified in their prior medical history. We can look at lab markers. So these are insights into chronic conditions like diabetes and kidney disease and how well those conditions are being controlled, identifying. You can look at utilization, coordination. Who are those individuals in your population that are at higher risk for poor coordination? So a lot of different capabilities, but here today, we just wanted to share a few of them and give you a small flavor of what KPI Ninja is offering through this partnership. Thank you, Amanda. I'll hand it back over to you.
Okay, great, thanks. Next slide, please. All right. So as Renee went through, we have a lot of capabilities that we look forward to bringing to WISHIN and all of you as participants as we complete the transition. But really initially, again, our focus is to work with Velatura and the WISHIN team to leverage what we have as strengths to maximize the capabilities in the short term, getting through to our end of September goal to roll out a robust community health record that has some analytic capabilities built in, has terminology services and supports kind of those care management and population health workflows, and leveraging those services from Velatura, again, as Melissa mentioned, with the back end infrastructure, the master patient index, all providing it on a stable AWS framework, as well as providing the implementation services around it to manage the project, advise on interoperability challenges as they arise, and really seek to arrive at a successful go live this fall, that we can make sure that your access to the data that you need is uninterrupted and is improved in what you're able to do on a day-to-day basis with the tool. So we look forward to that, as well as continuing to expand past that and really get to these advanced levels of support with our population health and analytics solutions. So I believe that's all we have from our introduction. Aisling, next slide. Yep, and I'll turn it back over to Joe.
Thank you. More to come, obviously. More fun stuff to talk about. But just wanted to give you a flavor of what's on the horizon once we get past the transition date. Did want to spend a little bit of time this morning just briefly explaining and or reminding folks that are from the hospital world that there is a Medicaid pay for performance incentive program that's beginning this year, and there's a substantial amount of money available to incentivize hospitals to maximize their data contributions to WISHIN. Can we go to the next slide there, Aisling? So every hospital received an email earlier this year from DHS explaining the program and explaining the incentive payment that they could qualify for. But in general, there are three criteria that, or three boxes essentially, that can be checked by hospitals / health systems. So the first box is ADT. Everybody who participates in WISHIN is sharing ADT messages, kind of by definition. The second being the CCDAs or the electronic care summaries. And then the third box is really a combination of 2 or 3 interfaces depending upon the EHR involved. So it'd be lab results, pathology results, and radiology results. So there's 3 possible boxes that could be checked in this program, and each one that is checked has a specific incentive amount associated with it. So next slide. So this program is making $8 million in total available to hospitals, and the amount that each hospital is eligible for varies based on the relative Medicaid claims volume of each hospital. So essentially, if the hospital is a large Medicaid hospital, and that is that's both Medicaid fee-for-service and the Medicaid managed care program. Larger Medicaid volume hospitals are on the higher end of the incentive payments, and the smaller ones are on the smaller end. But there's $15,000 to $40,000 per criterion. So the maximum then available to each hospital is between $45,000 and $120,000 for all three. It's important to note that the incentives apply at a hospital level, not an organization level. So an organization with, say, 6 hospitals, they would receive an incentive for each of the hospitals that they're contributing data for. And the eligibility to receive these incentives is based on the hospital's status as of the end of this year. And so what needs to be done is the measurement will be either, are you live with the indicated interfaces, or are you contracted to contribute that data as of December 31st of this year. There's no separate attestation process. DHS will just look to us to give DHS a summary of each hospital's status. Are they live with these interfaces, or are they contracted to contribute the data by December 31st of this year? So no separate attestation. Payments will be made, according to DHS, in approximately mid-February 2022. So with the amount of money available, and we've taken a look on a hospital-specific basis, essentially, on an average, the incentive payments that are available fund approximately 2.5 years worth of WISHIN subscription fees, based on 2021 fees. So, so pays for itself and then some. This incentive applies both to currently participating organizations and new organizations. So kind of a reward for the organizations that have done the right thing to this point, and an incentive to those who haven't been been in the picture or been contributing as much data as others. So one of the things I did want to mention is, if organizations sign up for all of the indicated interfaces, we will throw in the transcription interface. What we call the transcription interface is clinical notes, operative notes, things like that. We will throw in that interface at no additional charge, and that would represent all of the interfaces that we're dealing with. So we're hoping organizations will take advantage of this incentive opportunity. And again, the action needs to be done by the end of this year, either live or contracted. We are doing some outreach to organizations to give them the specifics of their particular situation with the incentives. We're happy to answer questions and kind of walk you through the contracting process. But we've got about 5 months left, and we hope everybody really takes advantage of this opportunity. So I will stop there. Looks like we might have some questions, Steve.
Yeah, Joe, I'm responding in the chat, and then again, these questions will be made available on our website. But one of the questions is real-time data feeds, pharmacy data feeds. So today we're receiving Medicaid fill history twice daily. We've just begun onboarding health plans and the health plan PBM data on a weekly frequency. The opportunity does exist, and there are sister HIEs across the country that have relationships with Walgreens, CVS, hospitals to contribute their pharmacy data and independent pharmacies. So we will continue to explore that. And a follow-up question to that, if that data is made available to WISHIN, who will see it, authorized users of WISHIN Pulse would be able to see it. And the goal is to use that pharmacy data as part of the super CCDA that Joe had mentioned previously for med reconciliation purposes and compliance. Also looking at med reconciliation solution within the community health record, so that MedRecs could be readily available to providers and pharmacists at the right time for the right individual. Another question that came up was in regard to social determinants information, and as I put in the chat, we're looking at the SDOH data that exists in the ADT feeds, ICD-10 codes, Z codes, or data that's social determinant data that is available within the provider source CCDAs or static documents that we will now be able to parse and make available in the community health record. And what Laura will present over the next couple days in a preview of WISHIN 2.0 are alerts. Now that if we can pull out that social determinant data, make it available within the community health record and highlight an alert within the community health record that some services, some needs exist for the patient that maybe they're not making known. That is a function we're looking at in addition to potential partnerships with SDOH specific organizations and how to establish bidirectional relationships so that screenings are made available in the community health record and part of a closed loop referral and CBO relationships can happen in partnership, tearing down the silos of CBOs and social determinant specific organizations and freely move that data between all organizations part of a care team. That's what we have right now, Joe.
Well, we're just going to take a minute or two just to preview the sessions that we have scheduled tomorrow and Thursday. Can we go ahead to that next slide? We conceive this one as the highest level of detail and meant it sort of to be an executive summary. Tomorrow, business overview, so a deeper dive into features and functionality, integration into workflows, and a preview of the new and improved WISHIN Pulse with the embedded analytics. And then Thursday, a little bit of a technical deep dive for folks who are, it's aimed primarily at the folks who are making the data flow and enabling the data to come back into an organization. So everyone is welcome at every one of these sessions. They have a slightly different emphasis, and all of them will be recorded, and we'll make sure that everybody knows when they're available to review. If you'd like to go back and you know, pick out your favorite part, or make it available to others in your organization who might not have been able to join us. So really gratified that we had so many folks attending today, and thank you for being here. Is there one more thing in the chat, Steve?
Yeah, there was, now that I look at it, regarding pop health analytics and how that information would be shared with organizations. We see that analytics, both pop health, patient specific, maybe a community-wide lab trending, COVID vaccination status, et cetera. There are so many use cases for the analytics that are at our disposal rather. that maybe KPI can chat to in areas I missed before we close here, but we're looking at an extension of the online platform of WISHIN 2.0. Where that sits is within what's called Ninja Universe. So KPI Ninja has a universe of products, one being analytics, pop health, value-based care applications, MIPS or ECQMs, and a variety of other solutions. So it would be an extension of WISHIN Pulse. Now we can integrate flavors of the analytics within the community health record, as you'll see in the upcoming webinars, but also how we can push and integrate within a participant's EMR, EHR care management system using APIs or FHIR resources. So the possibilities are quite endless. We are going to start with a focused set of analytic capabilities and dashboards. Then, as Joe mentioned earlier, we want to be intentional about our outreach and getting feedback from participants of, now what improvements can we make to the system? What are you looking for that would drive the success of your organization? And saying that many of these analytics are kind of on the shelf with KPI Ninja. We just need to unleash the power of the data that we have.
Right.
Renee or Amanda, anything to add, or Joe?
I was just going to say, I mean, although WISHIN isn't legally a cooperative, we essentially are. Our clients effectively own us. The whole concept of health information exchange is that mutual reciprocal benefit, where there's a neutral third-party partner sitting in the middle. That's WISHIN and our partners helping all organizations solve their interoperability needs, enable them to see beyond the four walls of their organization, and get everybody really on a common plane where the movement of data and the access to data is democratized, really. And we're looking forward to having those discussions and evolving our system along those lines.
And we do have one question that just came in, Joe, that maybe you're best prepared with your conversation with the state. P4P metrics shared across organizations. I don't believe that's the state's intent here, but.
The P4P program involving WISHIN participation is really just a measure of is an organization sharing certain categories of data, and if they're checking those boxes, the incentive payment is available. So I'm not sure if that was the question, but certainly the P4P status, the WISHIN participation status of every hospital is publicly known. Everybody knows who's participating in WISHIN and what data they're sharing. I'm not sure if that was the question, but it is essentially a public record of who's sharing what and who's getting those incentive payments.
Lynn, I've unmuted you if you want to clarify your question.
Sure, I just took me a minute to unmute myself.
Sure.
So my question was more around on an individual level, if certain P4P measures are hit, for lack of a better word, within a hospital organization or a clinic at an individual level. will that information be able to be seen through WISHIN so that we're chasing after the right populations to keep pushing those metrics forward?
I would say we could probably build capabilities with the analytic platform and identifying specific risk factors or impact on quality and care that you care about that are associated, closely aligned with the P4P measures or metrics. But that is an interesting question. I think and maybe closely related to value-based care analytics and dashboards that will be made available over time here. So across organizations, that's an interesting ask. It's for your benefit of managing the care and treatment of the patients, not a comparative, like maybe a MIP score that how do you relate or how do you compare to other organizations? That's not
it wasn't so much the benchmark comparison across organizations that was fueling my question. It was more being able to see that Jane Doe did in fact have a breast cancer screening or did.
Oh yeah.
Oh yes.
Yes. Yeah. Yeah. As it relates to mammogram, colorectal, A1Cs, blood pressure screenings,
exams, those kind of things.
Yeah, anything like QPP related or MIPS related. Yes.
Right. Yeah. Well, and that's really one of the core value props, right? Being able to see beyond the four walls of your organization, and you know, in a lot of cases, the question is, did the patient get the service? And it isn't so much did they get it from you, right? And so we can help like fill in those gaps, obviously.
Right. You know, so that we're not duplicating or chasing down folks trying to get them into things when they've already received the service.
Yeah, right.
We could spend our time and resources on those that have not. So.
Right. No need to do the outreach if the measure's been satisfied, right?
Right.
Yeah. Indeed.
Thank you.
Sure. Well, we are a little bit over time. Appreciate everybody's attention and engagement. Hope some of you can join us for the for one or both of the webinars that we've got scheduled. If there are somebody in your organization who might be more appropriate for the business or technical overview and you want to make them aware of those, we would appreciate that. We have a lot of people signed up for these webinars, but the more the merrier. Thank you, everyone. Thanks to our partners from Velatura and KPI Ninja. We look forward to continuing our conversation. Have a good day.